Globally, the United Nations Population Fund Agency's goal is working to reach what is called the 3 zeros: zero maternal deaths, zero unmet need for family planning, and zero tolerance to gender-based violence. UNFPA diagnosed that in Palestine, in terms of need for family planning and gender-based violence, they still have a long way to go. So with the help of the Italian cooperation in partnership with PMRS, they established a project. It's the Unfinished Agenda for Sexual Reproductive Health in Palestine.
The Italian cooperation is really committed towards the fulfillment of sexual and reproductive health rights within the overall commitment of our intervention in Palestine for the support of human rights.
We have realized that without addressing youth health and reaching the youth directly, we will never reach these goals. In general, young people, they don't see themselves as patients. There's nothing wrong with me. Why should I go to a clinic? But there might be awareness raising, there might be issues of changes in their bodies where you want to seek advice from a professional and you would not necessarily go to a clinic. So we are teaming up with the medical faculties, not only to have young doctors and nurses, but also have some of the senior medical students at the last year actually have some practicum.
The project chose 2 universities, Al-Quds University in the West Bank and Al-Azhar University in Gaza, to be the pilot project. The centres have been designed in 3 rooms. The main room is dedicated to be a waiting room for the students, but it is also dedicated to meetings and discussion in between students and health actors. The second room is dedicated to health service and examination. And the last one is dedicated to provide psychological services and counselling. Palestinian Medical Relief Society, with their tremendous experience in community outreach and training health providers, has been charged to implement those centres. For several months, PMRS trained students and teachers and also organised meetings with their local population and the students to understand their needs.
The center is run really with the contribution of the students in the campus. So the students who come here with initiatives to improve health, and also they have their own ideas and their projects to be implemented through this center.
Within a few months, through the Youth Health Centre in Gaza and in Abu Dis, students have been organising dozens of initiatives covering health issues such as nutrition, physical activities, psychosocial support, cancer, disability, but also reproductive health and sexual harassment.
أول شيء إحنا في مبادرتنا اخترنا موضوع التحرش الجنسي لأنه هو موضوع كثير مهم، موضوع ما عم ينحكى عنه، موضوع عم نعاني فيه بكل الأماكن، ما عم بحكي إنه إحنا يعني بس في كل المجتمعات وكل الجامعات شو ما كان مستواها فيها تحرش جنسي، بس مشكلتنا إحنا عم نسكت عن هذا الموضوع وما عم نحكي عنه مع أهميته الكبيرة.
The great strength of these centres is to involve students and the young faculty in the process. First of all, this ensures the financial sustainability of these centres. The university is covering the current costs by providing professional doctors and nurses and by teaming them with volunteer senior medical students. This provides a way for the students to build their CV and experience for their future career. It also allows an improvement of the service for less cost. And secondly, by involving students in the process of organising the activities, it establishes a sense of ownership and helps to create a feeling of security and respect for privacy.
ما يميز هذا المشروع أنه جاء انسجاماً لاستراتيجيات الإغاثة الطبية الفلسطينية، وأهمها الحق في الصحة النوعية للجميع، وتعزيز الدور التنموي اللي بيلعبوا الشباب في المستقبل الفلسطيني من خلال بناء قدراتهم وإتاحة مساحة آمنة لهم لينفذوا فيها مبادراتهم، وبالأخص المبادرات الصحية.